If someone in your office got stuck with a needle today, would they actually know what to do next? Not what the manual says. I mean, in the moment, would they know where to go, who to tell, what paperwork needs to be completed, and where they're supposed to go for medical evaluation? Because once an exposure happens, that's not the time to start looking for your exposure control plan. Hi, I'm Kelli Ngariki with Healthcare Compliance Associates, and we've helped hundreds of Oregon healthcare practices prepare for situations just like this. So I want to walk you through the 5 steps your team should know before needle stick or other accidental exposure occurs. And I'll also cover a few mistakes that I've seen practices make that can turn an already stressful situation into a much bigger problem. Step 1, take care of the exposure first. Take care of that exposed area. For a needle stick or a cut, wash that area with soap and water. If blood or other potentially infectious material gets into the eyes, nose, or mouth, immediately flush that area with plenty of clean water or saline. This sounds obvious, but when people panic, they sometimes jump ahead. They're thinking, who do I tell? Where's the form? What do I need to do? Start with first aid. And one thing I want to make really clear, don't aggressively scrub the wound or try to squeeze blood out. Wash the area, then move on to the next step. And remember, washing the area is not a substitute for medical evaluation. It's simply the immediate first response. Step 2, tell someone right away. Next, report the exposure immediately. Your employees should already know exactly who they're supposed to notify. Maybe that's your office manager, safety officer, supervisor, or another designated person. And this is an area where I've seen practices run into trouble. An employee gets poked and doesn't say anything. Maybe they're embarrassed. Maybe they think it barely broke the skin, so I probably am fine. Or they don't want to make a big deal out of it. Sometimes they simply didn't realize they were supposed to report it right away. That's why I tell practices, don't just have a reporting procedure on paper. Make sure your employees actually know what they're supposed to do. They should be able to answer these 3 basic questions. What needs to be reported? Who do I report to? And how quickly do I need to do it? The answer to that last one is always report right away. Some post-exposure decisions can be time sensitive. You don't want an employee waiting until the end of the shift or until tomorrow to mention what happened. Step 3, address source testing. Once the exposure has been reported, you'll also need to address the source testing when it's appropriate, and in Oregon, it generally is always appropriate. This is one of those areas where I don't want employees improvising. Your practice should have a procedure for what happens next, including how you handle the source patient and how you obtain consent when testing is appropriate. Generally, you're asking the source patient for voluntary consent for relevant bloodborne pathogen testing based on the exposure and applicable requirements. And yes, the patient may decline. If they do, make sure to document it. Oh, and by the way, document if they do accept it or decline. But here's the really important part. Don't let what's happening with the source patient delay care for your employee. The exposed employee still needs prompt, confidential medical evaluation. The healthcare professional that's evaluating that employee can look at the circumstances of the exposure, the information that's available, the employee's vaccination history, and determine what testing, treatment, or follow-up is appropriate. Your job at the practice level is to have the process ready so nobody is trying to figure it out after the exposure has already happened. Step 4, document what happened. Next comes documentation. And I know paperwork probably feels secondary when you're dealing with an exposure, but this is an important part of the process. Document what actually happened while the details are still fresh in your mind. Here are some things you want to cover. When did it happen? Where did it happen? What was the employee doing? What needle, instrument, or device was involved? How did the exposure occur? What did the employee do immediately afterward? And who was notified? Your exposure control plan should tell you what documentation your practice needs to complete. And depending on the incident and your practice, there may be additional record-keeping requirements, including your SHARPS injury log. But here's the part I really want practice owners and managers to think about. Don't document the incident and then stick the paperwork in a file and forget about it. Ask, is there something we can learn from this? Maybe an instrument was being passed in a way that created unnecessary risk. Maybe a SHARPS container wasn't located where the team really needed it. Maybe there's a safer device or workflow that should be evaluated. Or maybe the employee simply wasn't trained on the procedure. That's where documentation becomes more than paperwork. You're using the incident to look for an opportunity to prevent the next one. Step 5, get the employee medically evaluated. Finally, the exposed employee needs prompt confidential medical evaluation and follow-up. And please don't wait until an exposure happens to Google, where do I send somebody for a needle stick? Figure that out now. Your practice should already know where an employee will go. That might be occupational health, an urgent care clinic, employee health services, or another healthcare provider that you've designated for post-exposure evaluation. Make sure your managers know where that is. Make sure they know how to contact them. And ensure that you have a backup plan if an exposure happens late in the day or when your usual provider isn't available. The evaluating healthcare professional will determine the appropriate medical next steps based on the actual exposure. Your responsibility is to make sure the employee can get there without unnecessary confusion or delay. 5 things I don't want you to do. Now that you know the 5 steps, let me give you the 5 things I don't want to see happen after an exposure. Number 1, don't brush it off. Even if the employee thinks it's probably nothing, follow your exposure procedure. Number 2, don't wait to report it. This isn't something to mention tomorrow morning. Report it right away. Number 3, don't aggressively squeeze or scrub the wound. Wash it with soap and water and follow your exposure procedure. Number 4, don't forget the documentation. Document what happened, complete the required records, and then look at whether anything needs to be changed. And number 5, and this is probably the biggest one, don't assume your employees already know all of this. Having an exposure control plan in a binder doesn't mean your team knows what to do. They need training. They need to know where the plan is. They need to understand exactly what happens in your office if an exposure occurs. Quick review. So if you remember nothing else from this video, remember these 5 steps. 1, wash or flush the exposed area immediately. 2, report the incident immediately. 3, address source testing when appropriate without delaying care for your employee. 4, document what happened and evaluate whether anything needs to change. And 5, get the exposed employee prompt medical evaluation and follow-up. That's your basic roadmap. And the goal isn't to make employees memorize regulations. The goal is that if something happens on a Tuesday afternoon in the middle of a busy schedule, your team doesn't panic. They know what to do. Here's what I'd like you to do after this video. At your next safety meeting, ask your team one question. If you had a needle stick right now, what would you do? And let them answer. Can they tell you where they would wash the exposure, who they would report it to, where your exposure control plan is, and where they would go for medical evaluation? If they can't answer those questions, you've just identified a really useful training opportunity before someone gets hurt. We've also created a simple infographic with these 5 steps that you can download and post in a staff-only area as a quick reminder for your team. And if you're an Oregon healthcare practice and you're not sure whether your exposure control plan or post-exposure procedures are where they should be, you can schedule a free compliance risk review with Healthcare Compliance Associates. We'll help you take a practical look at what you already have in place and where you may have gaps. Because when an exposure happens, your employees shouldn't have to figure out what to do. The plan should already be there. If this was helpful, subscribe for more practical Oregon-specific compliance guidance. Thanks for watching, and I'll see you on the next video.